for coming. I think I'm going to be preaching to the choir here just a little bit because many of you, I know, have had really incredible continuing bonds, which is what most of us in the professional realm will call different experiences, spiritual experiences that we have. Continuing bonds is the kind of industry standard, at least here in the United States. So we want to talk a little bit about why they're important. And one of the things that we're looking at is these kinds of statements that we hear in our offices all the time. My husband came to me again yesterday and he said this, or he dropped a feather in my lap, or there was a penny at my car door, or whatever the case may be. And it's important to that client, certainly, to have that. This is a comment that we also hear very often, which is that most people think you're a Fruit Loop. And they're in counseling already, grief counseling for the death of their loved ones. And now they've got one more thing that they really believe that are making them look crazy, as if grief wasn't enough. They are also looking at what we need to know is that it's really our responsibility to help our clients, whatever they're actually coming in with. We break things down just as kind of a little bit of background as professionals looking at anomalous experiences, exceptional human experiences, and a sense of presence. We can actually kind of put those things in our progress notes so that they can be understood by other people that might be reading those. I work primarily with parents whose children have died, and most of those children are adolescents. There are a lot of court cases that I get called into for wrongful death suits. Either a medical issue or a traffic, they don't call them accidents, they call them crashes, the parents that I deal with. And so when I'm using anomalous experience or exceptional human experience or a sense of presence, those are things that have been researched a little bit, enough to be able to carry some weight in that kind of a court situation. I just wanted to show you that that we look at from an Anglo-European sense, we look at this being a very common experiences, that bereaved people have these experiences 40 to 60% of the time. And the Japanese have these experiences and will report those experiences, which I think is the key here, is that those experiences are actually reported about 90% of the time. So a lot of times our clients will come in and maybe you can relate with this just a little bit. They had kind of an initial surprise or disbelief that this was actually happening. They have this overwhelming emotionality. A lot of them have a lot of difficulty making sense of the experience. And a lot of times we can kind of track that back to their religious upbringing or the belief system of whatever it happened to be that they were actually coming through. These are unfortunately what a lot of our clients are really how they're responding to this. It's very difficult for them and placed on top of their grief process, it's really tough. As counselors, I know that is not a term that goes global, but as professionals who are working with people who are grieving, it's really important that we understand what it is that our clients are dealing with, and that we do not become taken by surprise. We need to have the language that we can actually help them with. We need to be able to normalize what's going on with them. We need to be able to hear it with what I always tell my students, with fresh ears. So it's the first time that we have heard this client say that. It may be the 15th time that we've actually heard them say that, but we need to be able to listen. We need to be able to respect. We need to be able to empathize, to accept, to normalize, and mostly to reassure them that they're not going crazy. This is not absolutely a part of the grief response. It is something that happens certainly outside of the grief response as well. It's just that their connection is a bit more heightened now since that loved one is now in spirit. So when we're looking at the positive meaning, we want to make sure that what has been happening in the literature for many, many decades, which is pathologizing what's actually happened, that does not continue to happen. Pathologizing is just assigning a diagnosis to someone or some behavior that someone has had. And we have had a huge fight in this country. Those of you who are professionals working with bereaved can understand that when the new DSM came out, we had a big fight about pathologizing those who are grieving and their spiritual connections, and the report of their spiritual connections was one of those things that was kind of creating this pathologizing. And we as professionals really need to work to not allow that to happen any longer. So again, this is about our willingness to hear whatever situation it is, whether they are finding this themselves, whether they're going to psychics or mediums, whether they are using an IADC program that I'll talk about here in just a second, whether they are using EVP. Most of the clinicians that I work with are a little bit behind the times in knowledge about what all of this really is. I presented it at our international conference, ADAC, Association for Death Education and Counseling, last year on the method of IADC, induced after death communication, and EVP. And the room was standing room only. And at the end, when we asked four questions, they just didn't quite know what to ask because it was such a new process for them. And that's so sad. That the clients that we're working with, the bereaved people that we're working with, don't have access. Their professionals that they're working with don't have access to these things that can be so incredibly helpful. One of the things that we do know is that all the history in bonds between people when they were living continues into the bond after they die. Someone who is on the other side is not going to all of a sudden like rap music if they didn't like it when they were here. Those connections that our people, that our clients actually have with those people who are in spirit now are so familiar to them. And it's so heartwarming for them to actually hear that and to be with that. We hear about signs and synchronicities. We hear about mediums and psychics and intuitives. Now we're hearing about induced after-death communication, about electronic voice phenomenon, near-death experiences, which I think Ian will be talking about here shortly, deathbed phenomenon, which he also is an expert with, ghosts, materialization, seances, and paranormal and extraordinary experiences. What's happening is so many professionals aren't aware of this list of things. And so the clients end up having to educate the professional that they're working with. And that's something that I think we might want to take a look at and do differently. So again, kind of preaching to the choir here just a little bit, but signs and synchronicities are all those things that are kind of listed here. The bird pecking at the window, the window, the tree blooming for the first time in a long time, pennies sent from heaven, rainbows, all the different things that are very commonplace when the professional is open to hearing about them. Otherwise, this information does not get it doesn't get said in the counseling way. And that's really difficult. Mediums and psychics and intuitives, I've spent a long time being able to support the work that they do with clients. I will tell you just real quickly that one of the things that as a professional, I will try to help my clients guard against a little bit is when they feel like they need to see that medium, that psychic, or that intuitive weekly or monthly. Those are things that are extremely difficult. I've had a couple of clients who've gone into bankruptcy because of the fact that they have spent so much money because they feel like that's the only way that they can connect with their loved one. In my practice, it's all about helping that client actually access their loved one in spirit themselves through meditation, through automatic writing, through ways that they can journaling, ways that they can actually work with them, IADC processing, EVP, although that's a little bit more difficult. At least it has been for my clients who've tried the EVP, but Sherry's on the line. I'm sure she can speak to that when we get to the questions time as well. So induced after death communication, I think that you would see that you might know Alan Bodkin and certainly Craig Hogan, our own Craig Hogan, who have brought this about. There's a second book now on IADCs from them as well, or from Botkin. It is a wonderful process. When the first book came out, I actually wrote to Dr. Bodkin to let him know that I was enthralled by the information in his book. But I was also intrigued because most of my clients, when I was doing EMDR with them, were going into this spontaneously. I didn't know what it was. I didn't have a name for it, but I certainly saw what was going on. And I also saw how incredibly helpful that really was for them. So I have a few slides here about of a client that I actually worked an IADC process with. I don't know, Wendy and Karen, if we want to take the time to actually show this process now, or whether you want me to move on.
No, go ahead. Do as you planned.
Okay, great. So this is what I want you to do. A client of mine, whoops. This is actually a client of mine. Her name is Christine. She has given us permission to be able to show you this. This is an introduction of Christine to IADC. I have it clipped very short, but we're actually using so with EMDR, it's eye movement desensitization processing. And so we're actually moving our fingers across the face of the client. They're following the fingers with their eyes. And this movement back and forth actually allows them to go into a much deeper level. Because I do so much IADC and so much EMDR, I actually use a device called Neurotech Light Bar, and it's a bar about 3 feet long that has little lights that go across, and they follow that with their eyes, as opposed to me doing this for hours on end with clients all day long. So you won't see my fingers going across, and you actually won't see the light bar either, but that's what's happening here. So her 18-year-old son was coming home from a concert in Cleveland, Ohio, which is about 40 miles north of us. The kids had gone to a concert. This was the night before his graduation from high school party. They were coming home, and they were hit from behind by a drunk driver that was going over 100 miles an hour. He was taken to the hospital, and he died about 7 days later from severe brain trauma.
Across from you. What I want you to do, Christine, is to just go to that moment in time when things were just so incredibly painful for you. And as you do that, just watch the lights go. And try to remember that in as much detail as possible.
You can see she's holding her head still and just moving her eyes. Okay, I'm going to move on. This next prompt on that was to think of the sights and the sounds and everything that was going on. This is at the end of the first set of processing, which was about 7 minutes in.
What was that like?
Painful.
Absolutely.
Yeah. Just taking myself back to that moment, you know, when we got the call, and then we just kind of like, I had a flash of when we were driving and trying to follow the GPS to where we needed to be at the emergency room, and arriving there and just having them tell us that he came in unresponsive and that they were working on him. And when you said to, you know, think of the feeling, I just, you know, immediately, like, my stomach just was in a knot. And the smell of the hospital. And then when it seemed like we waited a long time, and I just remembered pacing the hospital floor, waiting to see him. And then the doctor telling us, you know, that they needed to operate. They had to take him and remove part of his skull so that his brain could swell. And that we could come in and see him before he went into surgery. And I remember walking into the room, and he was kind of sitting up, and he was intubated. And my heart just sank. In a way, I knew. But I tried to be positive, and I talked to him, and I told him everything's going to be okay. Yeah. And it wasn't. Yeah.
So what I want you to do is to go with that feeling of walking in, seeing him, talking to him.
Okay.
So what's interesting is that, as you can see, the video kind of went out right when she started talking about what it was, how he looked and what it was like when she walked into the room. There was absolutely nothing wrong with the camera. Nothing changed. But she was told by Andrew, her son, after this process, "Mom, I don't want you to remember that." So he kind of blanked out the video portion of this particular one, which I thought was really interesting. So one of the things that we're looking for as professionals is a strong emotion. That kind of tells us that there's a connection that's been made, and you'll see that. This is about 12 and a half minutes in. Now we're processing the initial connection that she had.
I asked, I told him I wanted to see
I'm
him.
going to back up one here. There we go.
And what was the hardest part of that one?
It wasn't necessarily, you know, a hard part of, you know, maybe going in and seeing, I think going in and seeing him and remembering that he had a tear coming down his cheek. And I just told him, you know, I'm sorry, Andrew, and I told him we would get through this. And that everything would be okay. And then they took him into surgery, and I told him I'd see him when he woke up. And then I heard, Mom, I wasn't there. And then he said, you did everything right. You made all the right decisions. And he said, I'm so proud of you. And I told him I was proud of him too. And that we should have a big party for Aaron, because I remember telling Andrew, you know, since we had to cancel his graduation party. And he said, have a big party for Aaron. And he said everything's gonna be okay. And he's fine and he's happy.
What did he look like?
I didn't see him, I just heard him.
You heard him. Okay.
Yeah.
Okay, great. What did he sound like?
It's kind of, I don't know, it's kind of just a thought, you know. But in his mannerism,
Yeah.
of the way that he would talk.
Yeah. Has he said those things to you before? In that way?
He probably has, but not so conversational.
Mm-hmm.
It's been either like little bits or pieces or of word, you know, just a word or, you know, a couple of words. This time it seemed more conversation.
Mm-hmm.
Yeah.
So you understand that she was hearing from Andrew from spirit in a very conversational way, and not in a way that she had heard from him before. So after this segment, and we processed for quite a long time with us, she wanted to go back into it. She wanted to connect with him one more time as we were sitting in my office. And this is the second visit with Andrew on the same day.
I asked, I told him I wanted to see him. And I asked him to take me where he is so that I could see him. And the words I heard were, "It's not important." And I heard "in a dream." So maybe he'll come in a dream, which I don't have very often or that I remember. And I said, "I'm doing this so I could be with you," and he said, "I am with you always. I'm always with you." Yeah. So.
Awesome.
Yeah.
She, as we, well, let me do this one first. And
Jumped to like the very end when he did pass away, because I just said, when they took your body, I didn't even know what to do. It was like a new mom, like leaving the hospital without her baby.
Yeah.
And so I told him, I need to see you. Take me where you are. I don't know what it means that it's not important. I don't know what that means, but
Yeah.
maybe not right now. I don't know.
so as she was leaving this session, she stood at the door and kind of grabbed hold of the woodwork around the door. And she said, "Oh my God." I said, "What?" She said, "I have been begging him to tell me whether or not what we did and the decisions we made were correct." And that's exactly what he came through with. Not something that I knew, certainly, that she had been doing. Because of the surgery and everything, they actually had to kind of unplug him to let him go. That was very, very, very difficult. So the EVP is something else, and I'm not even going to go there. Sherry's on the phone, and I know that she has presented on EVP, and if you have any questions, I'm sure she will certainly give us that information. So basically, the group that Karen and I talked about when we were in Arizona is all about getting practitioners comfortable with these things, not having judgment, to respect what's coming, what they're hearing in their office, to normalize that. We need to be able to help the client explore the meaning of whatever their processing is, whatever their spiritual experiences are, in whatever, however they bring those forward to us. It's our responsibility to help them find an appropriate place for the dead in their lives. It's our responsibility to normalize that and to help them as much as we possibly can. One of the reasons why this is such a bugaboo, and Wendy kind of talked about this a little bit, so did Karen, and that is our licensures, our scope of practice guidelines. Most of us actually receive payment for the work that we do as professionals. If it's an insurance-driven practice, looking at spiritual things, we have to be very, very careful with, because they want a diagnosis. Looking at our clinical reputations, our clinical education, to find out where this is. And I'm so glad Dennis is on the line here today, because it needs to be researched. If we're coming from a research-based practice, which is what we have to do in the United States, we need the research out there for that. So we are here to support their belief, to listen with fresh ears, to make sure that we walk with our clients, and to be able to do what's necessary for their help. I have a whole bunch of references here. If anybody wants them, I can sure send them out to you. We can set up for questions. And then I just have a couple of slides on what we would actually be doing in the group as far as the purpose and the objectives. I think the big one is the fifth one here, which is the camaraderie with those who are doing similar work, because many of us are really out there feeling very alone. And here is the timing that we're going to at least start with for a global gathering. And so again, you'll have that. I think it's still being recorded, so you'll have that information as well. But thank you very much for listening. I have lost my professional home. ADEC does not want to really hear about this. They are not really interested in the spiritual side of it because it hasn't been really researched in a hard way. And so ARE is, they're adopting me whether they want to or not. So thank you very much.
Sally Taylor says, do you think the higher incidence of Japanese reports of AEs is because they have been part of the culture where ancestor worship is common?
I absolutely do. I think it's one of the things that we are certainly missing. The feelings, the emotion, and the consideration of spiritual practices, at least in the United States, is appalling to me. And I think as we start spreading the word and doing more and more of this, hopefully we can make some changes in that. But thank you.
Dr. Rubenstein, is there anything that you would like to add to the...
That's a very good presentation. Please, my name's Ian. No, I mean, it's very thorough. I mean, it's nice to know there's this work being done. But the sort of stuff I do isn't induced after death contact, which is very interesting. It's actually, I mean, I'm acting as a medium, which for me is important because I'm still trying to work out what the hell's going on with this. I mean, I come from a fairly materialistic background. But what I find quite amazing is when I sometimes pick up stuff that I couldn't possibly know that's validated by the patient. So I guess I'm doing fairly traditional mediumship stuff. I'm not very good at it, but I invite it into the consultation, and it's remarkably therapeutic. Mm-hmm. So I see myself as someone who's a bit sort of trying to put the word out that there's room for this in the consultation.